Hello everyone. So I'm Dr. Akhila Bhandarkar, considered endocrinologist, working in K.S. Hegde Medical College, Mangalore. So today I'm going to discuss a bit about pre-diabetes. So this is on the account of World Diabetes Day, which is going to be on November 14th. So the entire month of November is being observed as Awareness Month for Diabetes. So today we do see diabetes as such is quite common, but even if not for diabetes, pre-diabetes is seen very commonly. So it could be found out just accidentally when we do some health checkups for some other purpose, or it could be just found out on a routine evaluation. So what is pre-diabetes? As it rightly stands, pre here says that the person is not having diabetes at the moment, but he is in a state where it could be otherwise called borderline diabetes. So he could be predisposed to develop the risk of diabetes. So technically, the report basically says that our fasting blood sugar is not in the range of diagnosing diabetes, which is not more than 126 milligram per deciliter, but it's somewhere between 100 to 125 milligram per deciliter in fasting. So, or if we go by HbA1c, it says that it is not more than or equal to 6.5%, but it is between 5.7 to 6.4%. So this is when we call the person to be having as pre-diabetes. So what is wrong if the person has pre-diabetes? Does it need any attention? So definitely yes, because it is quite a misnomer to say that the person is not having any problem at the moment. But definitely when a person is going towards developing diabetes, it says that some change is happening in his body. So most of this change happens in something called as the bigger vessels or macrovascular issues. So when a person goes on to develop diabetes, it means that he is going to develop microvascular disease also. Microvascular basically says the problems that could happen with eyes, kidney, and the nerves also. But when we say macrovascular issues, it says that the problem could be happening in bigger vessels, so which could be supplying the heart or the brain, so mostly these people are prone to developing cardiac issues or stroke, or the leg issues, which we call it as peripheral vascular disease. So these are also quite common. So then what to do if a person has pre-diabetes? So is it really important that we take action then and there, or can we just wait the person to develop diabetes later? So prevention is always better, right? So prevention here basically comes to lifestyle, because the good thing about having pre-diabetes and not diabetes is that most of the times it is reversible by following a good lifestyle habit. So lifestyle including both eating habits as well as exercise. So what American Diabetes Association says is an exercise of about, say, moderate intensity of about 150 minutes a week. So which can be also told as about 20 minutes a day. Skipping about 2 days in a week is fine, but not for more than 2 days. So roughly putting it, 5 days in a week, 20 minutes of exercise of moderate intensity is what has to be followed by most of us. So, and what about diet? Diet is just like how a diabetic patient would follow, like mostly going to complex carbs rather than having simple carbs. So simple carbs means something which is almost similar to sugar or glucose. So that is, as soon as the food is consumed, the food with the simple carbs, it releases a lot of glucose, and there's a verge, it can go towards getting exhausted, or you can also develop insulin resistance, all such complications. So while complex carbs means it is not as similar to sugar, not as similar to glucose. So it has some sort of a combination of fibers, or something that has to be broken down further to simpler carbs in the body. So that would involve foods like, if I would say in layman terms, maybe something like idli. So food like idli would require breaking down in the body further to simpler glucose. Whereas if we go to consume something like, say, white bread, white bread has mostly direct glucose. So as soon as it is consumed, mostly it's going to be very similar to consuming sugar. So this is how we can, grossly differentiate between simple and complex carbs. And if you need more details, you can do a Google search on difference between simple and complex carbs, and what are the foods that come under the complex carbs. So giving some more examples would be like consuming more of millets, oats, the ones which have more bran, or even if you go for rice, more of parboiled rice or boiled rice rather than white rice. So these are all some of the examples for complex carbs. Even mixing this with more of proteins would also help, like consuming it with more of sprouts or dals, um, yeah, or mixing it with more of vegetables. So all this would make it a bit more complex. So fine. So then, what are the people, or who are the people who actually have to get screened for pre-diabetes or diabetes? So, if not accidentally detected, whoever has a lifestyle problem, like when we know that our physical activity is quite less, or the kind of diet we have is bad, it's always better to go for a screening. So, screening would involve giving a blood in fasting for both fasting blood sugar as well as HbA1c. Or those who are clearly overweight, or if you have a BMI of more than 35 kg per meter square, it's always best to go for a pre-diabetes screening. Or if you have a history of diabetes in pregnancy, so what we call it as gestational diabetes mellitus. So once we have it, there's a very high risk, almost more than 50% risk of developing diabetes in next 5 years after delivery. So it's very important that we go for an annual blood sugar checkup in such candidates. Or also, if we have parents having diabetes, even one of the parents having diabetes, it's always good to go for a screening if you are beyond 30 years of age. And if nothing at all, if you're perfectly healthy, still beyond 30 years of age, best to go for a screening every 4 years. So these are the indications when we would suggest you to go and take a blood test for fasting blood glucose as well as HbA1c. So putting everything together, summarizing, pre-diabetes is most commonly seen in people who have lifestyle issues or who are clearly overweight. And pre-diabetes is definitely not a naive condition. It can go to having developing macrovascular complications. So it's very easily treated and can be reversed by having a good lifestyle. Thank you.